health officer by profession, and I work for the county government of Kitui as a deputy director of public health.
So, Faith, let's talk about sanitation. What has been generally the county government strategy on sanitation?
Okay, thank you so much, and I'll briefly talk about Kitui County. And Kitui is one of the 47 counties in Kenya, which is in the eastern of Kenya, and it has a population of over 1 million people with over 200,000 households. And the coverage for the county is very vast, with over 30,000 square kilometers. So that is Kitui County. And in matter sanitation, we as a county had episodes of outbreaks of diarrheal diseases and all the cholera sometimes before 2010, and then in 2010 is when we embraced the CLTS approach to trigger communities to take a collective behavior change so that they can provide latrines and also use them. And we started by training public health officers in the county to embrace or to take up the facilitation process to the communities. So in 2011, we rolled out fully the CLTS approach, and we continued. And we had a vision of achieving ODF in 2015, which did not materialize. But in 2014, one of the districts in the county was declared open defecation free, whereby every household has a single latrine. Because in CLTS we do not prescribe any type of latrine, we just talk of as a latrine. But so that we can make our people get out of the bushes and they come up with simple latrines. Then in 2016 we started piloting the SATO products in the 30 districts. But the other districts which were not achieved ODF were really trying to push the agenda so that people, the whole county can become ODF. And in 2018, we were assessed and we were certified by the national government and 30-party certifiers to be open defecation-free county. So from there we now embarked on market-based sanitation to promote sanitation in our county, and also to enable our communities to climb the sanitation ladder so that we get out of the single latrine going to an improved and safely managed sanitation, whereby we are embracing use of SATO products to improve our sanitation systems, because their systems are available and they are also affordable and accepted by the community members. I really want to appreciate our partners who have really supported us, starting with UNICEF. Actually, UNICEF is one of the partners who has worked with us the journey since 2010 up to today. And we are also hoping that we continue the journey with them until we see Kitui becoming blue. So we really want to appreciate UNICEF for much support. Then I want also to appreciate Lixin for coming up with the SATOs, which are products that are bringing in inclusion of everybody accessing sanitation facilities, especially the SATO tools and the SATO funds and all that. So I'm really grateful to our partners, and also for recruiting distributors across the county so that we can have products reaching everyone at the sub-county level and also at the village level. Finally, I also want to appreciate the county government for the CHPs who are now the drivers of this agenda, and also the support that we will be giving to the community health promoters in terms of stipend. It's not small money. We really appreciate that.
Thank you.
3,000 households where we have installed SATOs, we have also installed SATO taps, and we have seen a lot of drastic reduction of diarrheal diseases. We have not any cases of diarrhea in those households, and the communities are also appreciating that they are not experiencing smell. They are not seeing the findings like red rodents like cockroaches, the flies and all that. So the SATO is taking care of all of that. and the community is really appreciating the sort of products. Yes.
My last question is, so what is the strategy going forward? Because you say so far, cumulatively, you have around 28% done, 28%. What about the next? How do you want to move forward?
Thank you so much for that. And one thing I want to appreciate our county government for bringing back our community health promoters, who are really very key. They are the drivers of this process, and through them, we are expecting that every CHP will be able to sell these sort of products to the communities. We are on performance contract, and we have also given targets to the community health promoters. And by so doing, we are expecting that by the end of 2025, every household will be having a sort of the community health promoters. So we are using the community health strategy as a platform for sensitizing our communities and also making the circles reach to the communities, common knowledge.
Okay, so finally, what do you tell your partners?
I want to really appreciate our partners so far for the support that they have been giving us as a county.
Maybe just say, okay. So, Rob? Okay.
Yeah, so far as a county, we have installed 23,333 samples in households. And also we have installed others in 107 schools. And then the sub-counties, the Kitui Central has installed 4,299. Kitui East has installed 1,123. Kitui Rural, where we started the pilot, is still the leading with 7,610. We also have Kitui South, 2,665. We have Kitui West, 2,726. Mungi Central, 1,693. Mungi North, 559. And for Mungi North is where we did a lot of samples in schools. Actually, I have not captured the number for the schools, but these ones are for the households. And we have Mungi West, 2,260, totaling to 23,333 samples installed. So that is not a very good number comparing the number of households that we have in Kitui County, because that is like a coverage of 10.4. But we also do other systems which are making us have a coverage of 28.5%. Yeah.
So the impact?
The impact we have seen, one, there is acceptability of the commodities. However, the price is really a challenge to the community because of poverty levels. But there is acceptability, people are likely to use them. And where we have installed these saddles, we have never experienced these diarrheal diseases, because we are doing also a full package of SATO toilet and also SATO hand-washing facility. That is the SATO tap. So there's the component of using the latrine, and there's also the component of the washes. So we are seeing a reduction of diarrheal diseases in households.
And pick your point from there.
Okay, I was saying that Kitui County has not experienced any outbreak of cholera since 2010, because the last one was 2009, which spilled over to 2010. Then from 2010 is now when we embraced community-led total sanitation, which triggered communities. And one thing to note is that one of the hardest hit districts is the one that was the first to become open defecation free, and that was Lorayata. It was really hit hard by the cholera outbreak. We had so many cases and also deaths, but since then we have not experienced another outbreak in this county. Out of the good work that the community is doing, the community health promoters and also the public officers. Yes.
Okay, talking about public-private partnership, you're in search, and to achieve your, the mandate of the work you're doing around toilets and sanitation. Who are you working with, and so far, how many people have you reached?
Thank you for that. And we have really partnered with our main partner in this is UNICEF and the LIXIL through programs whereby UNICEF started supporting us with capacity building of officers and also training of community health volunteers. We have also partnered with UNICEF in LIXIL to get the sort of products, because when we started we faced some challenge of stockouts. They were not available in the market, but now they are available. So we are working with that, and we are also working with the business community. We have distributors who are distributing in every sub-county the sort of products, so that the communities can have access at the community level, at the grassroots level. Yes.
Numbers, the people you've reached so far?
So far, we have reached over 23,000 households have installed SATOs, and we also extended this to schools. We have 107 schools that have also been reached with the SATO products, and we are aiming to move further. The schools and also the community, we are planning to move ahead, so that each school and every household has a blue toilet. As we say that we want to make this county blue. Even we are experiencing collapsing of latrines because the superstructure was not very good, and also the slab. But we embraced, when we are doing SATOs, we are also improving the slab. So we have seen, we have less number of latrines collapsing, and we have seen communities liking the SATOs, because one, the old latrines had a lot of smell, but SATO does not, you may not even know whether there is a latrine somewhere because of the SATO. Then we are not having some toilets where the elderly and also people with disability can use. But we have the SATOs tool, which is enabling those people who are physically challenged to be able to access sanitation services. Yeah. So for the SATO, we have really improved, especially in getting away with the flies, getting away with the smell, and also the latrine is also, the SATO is also attractive. It really welcomes one to the toilet. Yeah.